So now without further delay, let's begin today's event, sponsored by 2ndMD and hosted by Employee Benefit News. It's my pleasure to introduce your moderator for today, and that is Lynn Gresham, former Editor-in-Chief with Employee Benefit News. Lynn, you have the floor.
Thanks very much, Greg. Good day, everyone. We're pleased to have you with us for this web seminar, The Impact of Engagement Strategies on Utilization and Cost Savings. Today's program is going to show how the combination of meaningful incentives and thoughtful employee engagement actions can boost savings and employee satisfaction. Our speakers are Barbara Waxman, Senior Advisor with the Employer Health Innovation Roundtable, and Kristen Herrera, Chief Growth Officer at 2ndMD. Both have extensive benefits experience, and I'm going to ask them to share some of their background with you now. Kristen, would you please tell us about yourself and your role at 2ndMD?
Sure. Thanks so much, Lynn, and really excited to be with everybody today. As Lynn said, I'm Kristen Herrera, the Chief Growth Officer with 2ndMD. I have responsibility for sales, client management, and marketing. I've been with the company for 5 years, and prior to that, I spent 14 years at United Health Group in various sales and client management leadership roles. Boy, the topic today is an important one for everyone, engagement. Such an important topic for employers and health plans. Without it, you really can't drive value. And so we're really excited to be with you today. And I'm honored to present today with Barbara Waxman. Barbara, you want to give us a little bit more about your background?
Yeah, sure. Thank you. Hey, it's great to be here today. Today I wear many hats. As was mentioned, I'm currently a Senior Advisor to EHIR, the Employer Healthcare Innovation Roundtable, a mouthful. Some of you may be familiar with it. I'm also today an advisor to a private equity firm that specializes in healthcare, and I support several startups in the healthcare field. I'm essentially the adult in the room for a number of startups. But most recently, I was the Director of Strategy and Engagement, underlining that word engagement, for Disney, where I spent, the last 12 years or so working in benefits and figuring out how do we motivate our employees to do the right thing. So I'm going to hopefully today sprinkle in a few of my experiences at Disney, which hopefully sound relevant to you, and really looking forward to the conversation. So thanks, Kristen. I'll turn it back to you.
Great. Thanks so much, Barbara. And Barbara was really intimately involved as part of her role at the Employer Health Innovation Roundtable in helping us conduct a study. We really wanted to better understand how different engagement strategies that we deployed with 4 key customers impacted overall utilization, satisfaction, and cost savings. So we're really excited to kind of walk you through the results of that study we did together with Barbara and EHIR. And this is a webinar about engagement, so we're going to try to keep you engaged throughout. As they mentioned, there are going to be some polling questions, so we look forward to you to participate in the polling questions and then during the Q&A at the end. First, I'm just going to spend a few minutes giving you an overview of 2ndMD. So we exist to save and improve lives every day. Really, our vision is to connect everyone affected by pain or disease with the best healthcare resources the world has to offer. Everyone at 2ndMD shows up every day with this mission in their heart, and we really serve our members, with love in our hearts. And I think what you'll learn today, as we share some of the different strategies and a case study specifically for one of the employers that we looked at, is that the consumer experience has more to do with engagement than what you might think. As leaders in virtual expert medical opinion solutions, we really solve complicated medical problems using world-class clinical expertise and sophisticated digital technology. We have created a multimodal platform that allows us to communicate with members in really unique ways. And when we combine this engagement platform with the elite level clinical expertise that we have in our panel, we're able to solve complex medical problems for the 5% of a population that is driving 50% or more of the cost. This is not a traditional second opinion solution. We really leverage technology and a high-touch consumer experience to really help people get the right care with the right doctor the first time. And, as a result of that, we've really emerged as the leader in providing expert medical opinion services. The innovations that we've brought to Second Opinion have contributed to pretty significant growth. Last year, this time, we had just under 100 enterprise clients, and now we're serving over 300 enterprise clients covering several million members across every industry and demographic. The nation's largest health plans analyzed the market and chose 2nd.MD as the best solution for their client. And we've really spent years integrating with health plans, with employers, and other ecosystem partners to drive the highest utilization in the market, all while providing a really incredible consumer experience. And we're really proud of our Net Promoter Score of 92. At the end of the day, I think the innovation that we've brought to the market is that members are looking for convenience, quality, and speed. And the innovations we've brought to expert medical opinion really consistently deliver on all three of those. So that's a little bit about 2nd.MD and who we are. We really want to spend most of our time with you today talking about engagement. Employers and health plans alike, struggle with engagement. You do a great job of identifying high-value programs and innovations in the market, and bringing great solutions to your employees and to your members. But if you can't get your people to engage, then they're not worth anything. And I think creating sustainable engagement is really the holy grail. And I think it's something that we all struggle with. So today we want to share, a little bit about the success we've had with engagement, and hopefully at the end get some of you to share some of your success stories around engagement at the end. But we're going to just kick this off with a polling question. Some of the engagement strategies that we're going to talk about today involve incentives, whether they're either cash incentives or plan design incentives. So before we get started, we just want to understand how many of you today are implementing incentive strategies to drive or increase engagement. So it's a simple yes, no. Just click the radio button on your screen, and then we will review the results in just a second. Thanks for participating. I'm going to review the results now. And as we do that, Barbara, you do a lot of consulting with employers and health plans, and in your experience at Disney, what are some of the engagement strategies that you've seen be effective?
Well, that's a great question, and I also just want to mention one quick thing following up on something you just said while we're waiting for the results. It has never been more important now to have those engagement strategies in place to get your employees participating in your healthcare programs or your retirement programs, your benefit programs, because we're in a totally new world where employers are suffering financially, employees are addressing affordability issues. So we really we curate these programs for our employees, and we really want them to engage. Additionally, as you're putting these programs in as benefit personnel, and you go up to the C-suite and you've just been given, $10 million to put in this great program and no one's using it. In this era that we're in now, likely that C-suite is the message is going to come back down to you, which says, why are you running this program? So for every good reason, we need to really focus on engagement in this era of COVID. So back to your question, and then I know interesting results are coming up. In terms of the types of incentives that we see, definitely cash ranks up at the top. Cash is king in many cases, although we're going to talk a little bit more about what might be right for your organization, but definitely to be able to incent someone by paying them for taking a particular action or having a particular outcome is important. You also see where a benefit design might become more, more amenable to the employee, where suddenly if you participate in something, your deductible is reduced or you have no copay. This is called, incentive benefit design. And then there is the famous frozen carrot, which is where there is more of a negative incentive, and that is if you don't do this, you will pay more. And while, I'm sure there are people on the phone that really are highly skilled in understanding aversion to negative outcomes and all these great behavior theories that are out there, very few companies actually are able to put in a negative incentive, but when they do, they get very high results. So we'll talk more about some of the different incentives that these 4 companies use that we looked at.
Thanks so much, Barbara. Well, I'm really encouraged to see these polling results. It looks like a lot of you are really leveraging incentives to drive and increase engagement, which is great. And hopefully for those of you that aren't, you'll get some really good information during our session today. So let's keep going. I'm going to share a little bit about just 2ndMD's overarching member engagement approach, and then we're going to kind of get into the details on what our study with Barbara and the Employer Health Innovation Roundtable revealed. So I think one of the keys and one of the unique aspects of the way we approach member engagement is that we really put the consumer at the center of everything that we do. And we really partner with the health plans that we work with and the employers that we work with to really understand their culture, to really understand what's been successful before, and to really understand their population, right? A lot of clients have very different populations, and we want to make sure that the communication and the engagement approach that we take really is customized to the unique needs of our customers. And then, throughout that, we really need to make sure that we're personalizing communication, making our communications impactful, simple, easy to understand. And then, you heard our mission, compassion and love is kind of at the center of the way we serve our members. And so that really comes through in our member engagement campaigns. This is a service that, only 5% of a population may need in a given year when you think about an expert opinion. And so we really want to try to meet the consumer exactly where they are so that they're aware of this benefit at exactly the time that they need it. And I think that's where we've really invested heavily, and we've really brought an incredible amount of innovation to really leverage data in a way that allows us to drive engagement with precision. What do I mean by that? We're taking in client eligibility, claims data, and prior auth data. We're also taking in predictive model data from the health plans, but we've also built our own predictive model engine so that we can really, really identify and outreach to members when they have the most need for our service. And we look at this throughout our relationship with a customer. So we do a lot of pre-activation engagement strategies. We think it's really, really important to kick off this service with a splash because it really is a gift for your members and for your employees. Members see this type of a service as a lifeline, so you should get credit for providing members with access to elite level specialists that would typically take them months to see if they went to see them in person. So, doing Big Splash at the beginning of the 2ndMD launch has proven to be really effective. Building awareness around high impact topics, especially during COVID. A lot of people delayed surgery, and so we've got some campaigns going to really make sure that members are checking to make sure that surgery is the right thing for them before just going back in and getting that surgery that might have been delayed. And then really precision targeting, using our predictive model and identify people who are on a pathway to a high cost or a high impact event, and then proactively reaching out to them to make them aware that they have access to this service. And then we found that ongoing awareness and ongoing awareness campaigns to activated members and through text, email, and direct mail are really, really important because what we found is that our customers who do not engage in ongoing awareness campaigns experience a 15% erosion in utilization. So that ongoing awareness is really, really important. And then we find with this proactive kind of algorithm-driven outreach, we're driving an 80% increase in cost savings per household. And then when you layer in some of those incentives programs that Barbara talked about, whether it's a cash incentive or a frozen carrot or a plan design incentive, we're seeing 2 to 3 times the utilization compared to an employer population that may just be communicating. So precise targeting and outreach is where we've seen a lot of success with engagement recently. And we also find that, it's really important for members to be aware of the program because 70% of our utilization comes from self-referrals. We do a great job of integrating with health plans, and we get really great referrals from clinical care management teams at the health plans. But at the end of the day, most of the time, it's the individual consumer who's raising their hand and saying, I need help. And so we found that clients who kind of adopt our best-in-class awareness campaigns find a 24% increase in completed expert medical consults, 11% increase in requested consults, and overall 45% increase in account activation. So communications work. If you're targeting the audience and you're really creating impactful, compassionate communications, they do work in terms of engaging clients. And we'll have some great data to share with you for the results that we have with one employer who really just adopted a communication campaign and really didn't implement incentives or anything else, but they were still able to effectively drive engagement. So let's get to another poll here. It was great to hear that many of you are using incentives for engagement. Would like to understand a little bit better which engagement strategy would you most likely choose for your organization? Would you typically choose a communications-only strategy, or would you layer in a gift card or cash incentive with communications, or this predictive model kind of proactive outreach with communications, or more of a plan design penalty or requirement with communications? So I'm interested to see your results, and then I'm going to pause and see if Barbara has any insights to share based on the overarching engagement strategy that I just discussed and what you kind of took away from some of the surveys and interviews you did with the 4 customers that we targeted for our study.
Yeah, sure. So, I first want to comment on a really interesting point you just made, and that is self-referrals. One of the most interesting things we discovered in this study was what we have termed the ripple effect, and that is when you've got a high level of customer service that your employees really, really like. It really speaks to what their needs are. The word of mouth creates this kind of ripple effect that you rarely see when you have something top down. Let's just say your C-suite or your senior management says, look, you really need to participate in this. That doesn't work. What does work is bottom up, where you've got employees who are extremely happy with the process, with the solution, and then they're out talking to each other. I will say at Disney, word of mouth among the employees was probably the most powerful tool we had to encourage employees to participate in the program. And likewise, if it is not a good experience, that word of mouth can really totally destroy a program that you thought made so much sense. So in this case, it was about a superior customer experience. And honestly, we went into this study really not knowing that much. I mean, knew a fair amount about 2nd.MD, but didn't know what the perception was of the customer experience. And we really saw this ripple effect driving overall utilization. So that was terrific. And then, Kristen, of course, as I'm yakking on, I really forgot the question that you had for me, which was the specific incentives among the 4 employers that we talked to. Was that what you were asking about?
Yeah, but I think we can pull up the polling answer, and we'll get into that when we get into some of the details. So I think we'll get to that question in a little bit. That was a great ad, and really appreciate your insights there, Barbara. So let's look at the results. Okay, so great to see the predictive model outreach and communications, because that is a really impactful driver of utilization that we saw a number of the clients in our study leverage. Penalties and requirements is a lagging engagement strategy that we think is becoming a little more progressive. One of the clients who wasn't in this study was a large energy sector client, and they actually put a plan design penalty in place, and they couched it within their culture of safety. So the way they communicated that strategy, which, you know, nobody likes to get a penalty or be told they have to do something, but when they couched that in the culture of safety, and it was an incentive or it was a penalty aligned with a musculoskeletal surgery. And so the thought process was surgery, especially unnecessary surgery, isn't safe. So let's make sure you're on the right path before you get an unnecessary surgery. And so it's great to see that some of you are considering that. Any comments, Barbara, any reactions to this?
Yeah, let me just add one. First of all, this issue of incorporating it in safety, does that work? I mean, that and the whole organization typically will support something like that, including the C-suite and what you're trying to do. But I don't want to suggest also that we aren't realistic as we talk about incentives, especially cash incentives, gift cards, and so on. I mean, there's a cost to this that may not be in your budget. And you may have a C-suite that thinks people should do the right thing and not get rewarded for it, that they should simply want to do the right thing. So I just want to underscore, we certainly have an awareness of the politics involved with incentives, the budgeting issues that are involved, and this could really take a lot of very hard work. Now, I will say the beauty of 2ndMD's team is that they are very cognizant of this. They are behind you 100%. They will provide you the information you need to be able to take to your senior leaders and say, hey, look, we're putting a program in, and we'd also like to earmark, $1 million for incentives. Here are the results that we can expect. But just wanted to add, not being, Pollyannish about how difficult some of this can be, but it really can be very effective if you can make it through.
Great. Thank you so much, and thanks, everybody, for participating in the polling questions. Let's get into some of the details around the study that I talked about at the beginning of this webinar and give you some details around it, right? So our goal was to really kind of look at 4 different employers and who took very different approaches to engagement in terms of, 2ndMD and the 2ndMD solution, and really have Barbara and the EHIR team take a look at those strategies, interview the key members of the HR and benefits team, and really get an understanding of, what were some of the specific engagement strategies that were deployed, how did it tie into their overall total rewards strategy, and, what were some of the qualitative and quantitative measures that went into those decisions, and then ultimately seeing what kind of impact did it have. Did it work? Did we see greater utilization or greater cost savings or greater employee satisfaction with, the different engagement strategies that were utilized? So, Barbara, any just initial thoughts as we start to dive into some of the results?
Yeah, I mean, this is kind of the gut of the study. I will say this. It was a qualitative study where we spoke at length with open-ended questions with 4 companies. But for the data geeks on the phone as well, there was a lot of great data that we were able to look at behind the scenes as well. So very current data from 2019. We were able to look at utilization rates, cost data, and so on. So it's a really interesting blend of qualitative and quantitative data that we looked at. I will also say, even with just 4 companies, we saw some consistent themes. And I hope you find interesting as we talk about each specific company, they're all very different. And they all think about incentives in a slightly different way. And I think the takeaway there is that they understand their employee population, they know what's going to drive them, and they designed incentives and communication strategies, which, kind of go alongside. And honestly, I'll admit a bias I have, which is communications is not necessarily an incentive program. I mean, that is creating awareness. You need to get people to actually pick up their laptop and click on something. So, yeah, I mean, I'll just pause there, and I know we'll get into more details about the specifics and about the specific results, some of the data.
Yeah, absolutely. So we're going to get into the findings. And, I think, you just talked, Barbara, about some of the themes, some of the overarching themes that you found across the 4 employers that were part of the study. Do you want to maybe go into a little bit of detail on what you found?
Yeah, sure. And I'm sorry. Let me just go back for 1 second and just again tee up the difference in these companies and who they are. It's just super interesting. And actually, some of those folks might be on the call today, so a shout out to them. We spoke with CenturyLink, who you probably know from the tech telecom world. They really focus on very highly personalized communications. Now, they also did predictive analytics. They also did referrals from their health plans. They did a lot of other things, but I think what stood out for us from CenturyLink was this highly personalized approach. And I think we're going to actually talk in much more detail about CenturyLink in a minute, so I'm not going to take away the surprise of actually what they did. We spoke with a really large technology company who had a very direct incentive program, cash payments for coming in, taking a look, using data that 2nd.MD provided in terms of the right primary care physicians for them, and paid them to do the right thing. And they got tremendous utilization, and we're extremely happy about that. This was in conjunction with them changing some of their on-site clinics and getting employees to come in, decide on a new primary care physician that 2nd.MD would tee up, and working with that physician. ArcBest, super interesting company. This is essentially the logistics company for Walmart based in Arkansas. Super smart people, used every lever that they had, but really what ArcBest did was use second opinion as a cornerstone of their overall strategy. So their strategy was about their benefit strategy, creating a culture of health. And this idea that you are not going to waste time with poor quality care, you're going to go to the best providers, you're not going to engage in care that's not useful. This is what we're all about in our healthcare benefits. So ArcBest was, at the number 1 in terms of embedding this as part of their culture. And then Sedera, super interesting as well. This is how do I describe it? It's a medical service plan where members join together and pay into a fund, which in turn then is drawn out of as you incur costs. And in this case, it was extremely important to Sedera that their members would have kind of the encouragement to really understand what their own needs were and to take some control over their health care. They were especially concerned about avoiding bad care. So they really felt an obligation to describe to their employees, this is the place that you should go for care, and talk to 2nd.MD about where the right place is for you to go. So that's kind of, it in a nutshell, very different companies. And I will say that Sedera had more of the, penalty, if you will, and that is if you do not participate in 2nd.MD, you potentially will be reimbursed less for your medical care. So people highly motivated to use 2nd.MD. And then quickly to actually get to what Kristen asked me to comment on, and that is a summary of our findings. Number 1, which I thought was really one of the most interesting things we found, yes, cost savings is important, and cost savings will come. And for those of you that are interested in quality care, you know that quality is most important, and cost savings do come from improved quality. But for 2nd.MD, what employers really wanted to do was improve the experience that their employees had with healthcare. They wanted to improve outcomes, but really wanted to improve the overall experience that the employee had in engaging in the healthcare system, which of course is the right thing to do, because people will do the right thing if it's a good experience for them. And then ultimately the lower costs, which I think they did see, you will see, and that comes over time as people try to focus on better quality care. We did also find out that utilization is impacted by incentives. And doing proactive outreach, Kristen had mentioned predictive analytics being used, and that would be, for example, you see someone who's engaging in a lot of services that might indicate back pain and that they might be thinking about having surgery. Well, we all know that low back pain sometimes is not best taken care of by surgery, that there are many other things you can do in a treatment plan. And in that case, the predictive model may say, hey, you might want to reach out to Barbara and talk to her about other ways she can address some of the issues that she's experiencing in the MSK world. And then also and then I guess I'll just mention that MSK and oncology are two of the top use cases, but the companies that we spoke to were so happy with 2nd.MD. Most of them were expanding the care to all conditions, and in fact, one employer expanded care not only from their employees and dependents, but also to the parents of the employees, which says a great deal about 2nd.MD. I'll just reiterate what something I said before, which is that many felt that this expert medical opinion really did either endorse their idea about developing a culture of wellness for an employer, or really help send that message out and said, look, we really do care about you, we want to provide valued services to you, and we have a program that's going to help you do that. And then finally, again, going back to this issue of the ripple effect, programs with really high user satisfaction and a very exceptional customer experience, and I hope we talk a little bit about this, Kristen, have high continued usage. And that is this word of mouth, this ripple effect. As people are satisfied with the program and they talk about it, more people start using it. And then finally, I think what we did see is that all these companies had a very customized approach. And it's pretty hard to just identify one bucket in particular. Oh, somebody uses cash, or someone might use a benefit design change or something like that. I think each one of these companies knew their employee base or knew their member base, in Sedera's case, and knew what was going to motivate them. And I'll tell you, this is not easy. I'll use Disney as a quick example. You know, we did the same thing for all 200,000 employees. So that meant crafting an incentive program that would appeal to the highly paid talent in the studio, as well as to the landscaper or the housekeeper in the parks. This is critical for you to understand what is it that's going to motivate our employees. And it might be a combination of things. People have different access to data. There are just a number of things that go into deciding, is it one incentive, is it multiple incentives, how do we do that? But we did find on all of these companies there really was a more customized approach that really aligned with their particular culture. So I think that's, I kind of went on a little bit too long there maybe even, but I'd say that's the overall summary of what we heard.
No, that was super helpful, Barbara. Really appreciate it. And now I'm going to show a slide which shows the results. And we're going to do a case study, so we're going to take a deeper dive on the CenturyLink results. But just a couple of things to highlight based on, what Barbara just shared about the studies that we did. So ArcBest did an incentive for people to activate their accounts with 2nd.MD. And you can see here the registered users for ArcBest is 75%. So that was an incentive strategy that worked. And then once people have an activated account with 2nd.MD, we can message and text and engage them when needed, which is really helpful. And we see a very, very low opt-out rate when we're engaging members who are registered through the platform. They also have a really, really high expert consultation utilization rate at 3.3%. They're really getting close to that optimal 5% of employees driving 50% or more of the costs. And they had a really successful strategy where we integrated with Castlight to drive increased engagement. So I think that's some of the benefit there. When you look at the large technology company, their cash incentive programs for high-impact surgeries. Also, we have, almost 2% utilization there, and that's sustaining even into this year. Really powerful. The Net Promoter Score across all of these customers is north of 85, and in the case of ArcBest at 95. So whether it's a penalty or an incentive or proactive outreach, still a world-class consumer experience. But I also want to point out, to those people who have either requirements or penalties or frozen carrots, I think, as you had mentioned, Barbara, Sedera did have kind of more of a mandate in place, and you can see their expert medical consult utilization was 4.5%. So while penalties may not be optimal for everyone, given your culture and given your approach, they can be extremely effective in driving results. And, the cost savings here, all really, really strong results. One thing as we go into the CenturyLink case study, in the first year, which we evaluated here, they only used our service for musculoskeletal. So all the other employers were using us across all diagnostic categories. Their per employee per year savings were higher. CenturyLink ended up rolling the service out to all conditions in the following year. But in the case study that we did here, this was just for musculoskeletal. So really, really strong results considering that. Any other comments, Barbara? Yeah.
Yeah, I was just going to make one follow-on comment as you look at the cost numbers. These numbers can be driven by other, there can be other reasons that these numbers are lower or higher. You will save money as people do get improved treatment plans, for example. It may be further down the road. An improved treatment plan might even be a little more expensive than the original treatment plan. So it's very hard to look at these cost savings numbers and do a comparison. It really is important for the population that you have. You might have younger employees. You might have older employees. You might be in a market that has extremely high costs, and you are going to be, through 2nd.MD, sending them to physicians that are lower cost and more effective. So all these things come into play as you're determining what your cost savings is. But as you can see across the board, there is cost savings when there is an improvement in quality.
Great. Thank you so much, Barbara. Really appreciate your insights on this. Now we're going to jump into a case study. We're going to share a little bit more about CenturyLink's results. What I love about CenturyLink is that they have an incredibly strong culture of health and well-being. They really, really promote that. They believe in a healthy and engaged, high-performing workforce, and that's a competitive advantage for them. And so I think that's awesome. And they really, really invest in their employees' health and well-being. So that really kind of warmed my heart and rang true as we were working with CenturyLink to kind of complete this study. Just to give you some overview in terms of the history and the goals of 2nd.MD, so we launched the 2nd.MD program in January 2019. CenturyLink has about 36,000, just under 36,000 eligible employees. Musculoskeletal was a huge pain point for them. It represented 15% of their medical spend. So that's where they wanted to focus initially with us, and we do that often. We'll start with just focusing on one major diagnostic category, and that's what we did with CenturyLink. So the results we're sharing with you here are just relative to the musculoskeletal program. They took a really, really kind of unique and multifaceted engagement approach, which I think really helped the success of this program. They absolutely did targeted communications to make sure that members were aware of it. It included home mailers, internal newsletters. Because of their culture of wellness and well-being, we were, splashed onto their wellness page, and we were featured in webinars and health fairs. And so a groundswell of kind of communication efforts to build awareness. There was a lot of training that we did with the health plan. So with the United Healthcare clinical teams, and there was a lot of support in terms of referring members over to 2nd.MD when needed. We also get a predictive model file that which feeds our proactive outreach to members that we were using on behalf of CenturyLink for this program. But one thing, and I'm going to ask Barbara to talk about this, that really was kind of unique is that during the implementation process, there was a CenturyLink employee who needed our help. And so we, of course, didn't need the program to be launched to help someone in need. And this person had such a great experience with us, they did a video testimonial that was then used in the launch of 2nd.MD for CenturyLink. And Barbara, you want to share some of your observations with that?
Yeah, I loved telling this story, and I loved hearing this story. It was really amazing because it speaks to so many of these issues that we're talking about in terms of incentives. But first and foremost, this is an employee who had a really difficult problem to solve, came to 2nd.MD, got the problem solved, and it made a huge difference in his life, and he wanted to talk about it. And CenturyLink took advantage of that. They created a very polished professional video, and they put that video out on various platforms for employees to see. They got incredible reaction. This video made its way up to the C-suite of CenturyLink and just endorsed everything that CenturyLink was trying to accomplish with offering 2nd.MD. But it also did a couple of other things. We haven't, I mean, there's so much more we can talk about in terms of incentives. But one thing we haven't talked a lot about is this idea of champions. And I'm sure many of you on the call today have wellness champions, for example. This guy ended up being a champion for 2nd.MD, and again, was part of creating that ripple effect of saying, and employees talking to each other and saying, did you see that video? That is so amazing. Look at the results that he had. Look at how much 2nd.MD helped him. It just made all the difference in the world and really created, he's a media star. He really created a buzz about 2nd.MD and, most importantly, the value that it brings. So, it was just one of these things that just right time, right place for the right population. I want to just mention one other thing about CenturyLink, Kristen, if it's okay with you, a little bit off the video topic. But one thing that they did, and they were very upfront about, and that is they felt that they could put in place programs that the carriers really have not been able to put in place. And, we all love our carriers. We all know that they can do a lot for us. But being able to provide this kind of second opinion, highly customized care management plan, if you will, has been difficult for them. So they were able to still involve the carrier, get referrals from them, and I think it was United, actually, if I remember, but, Optum was very involved. But basically they said to their carrier, look, this is where we think we can fill a gap with something else that we know really works. So while we want to continue to work with you on this, we want to take in data, we want to have your nurses refer to this program, we've got this one. And it really made a difference. So for many of you that may be thinking, well, shoot, how do I integrate these programs into all the medical delivery systems I have today, whether they're point solutions or it's my overall medical plan, there are ways to do it, and it really can be effective, the partnerships that 2nd.MD can develop.
Yeah, absolutely. And United Healthcare and Optum really make it easy for their clients to add our service. They can add it with just a simple amendment to their ASO agreement. So we have a really good relationship there and appreciate you sharing that story. I'm just going to click through a little bit more results on CenturyLink and then make sure we have some time for Q&A at the end. So when you think about an expert medical opinion program for musculoskeletal only, 3.5% of their employees activated their accounts after we launched. And in that first year, we completed 413 expert medical consults, which is about 1.2% engagement or utilization, for that specific part of the program. We offer other services, including specialty care navigation, more case management, and also helping people find high-quality local specialty care physicians. We do that on a standalone basis, so that accounts for some of the other utilization for CenturyLink. But boy, on the expert medical opinion side, we had a real impact in engaging this population. And the results, I'm noticing the percentages off here on the slide, sorry about that, but the results were powerful. Almost every single person we did an expert medical consult for had an improved treatment plan. 49% of surgeries were canceled as a result of a member being able to see and speak with an expert. And 35% of consults led to an alternate diagnosis. You don't always think about that in a musculoskeletal kind of diagnostic category, that maybe you're completely misdiagnosed, or maybe your local physician hasn't found the pain generator source, and maybe that surgery is going to do more harm than good. But I think what's really powerful from a cost savings impact is, remember back 15% of their costs were from musculoskeletal. We were able to generate a 6% reduction in musculoskeletal spend from 2018 compared to 2019 with this program. And that information came from the health plan. That wasn't our data, that was the claims-based data. So just a huge impact on cost, quality, better outcomes, and productivity. Almost 2,700 recovery days saved because of those avoided surgeries. And, the CenturyLink, people really, really love the service. They have an opportunity to complete a survey immediately following the consultation experience. We find that over 85% of people take the survey. They rate our expert doctors' care, their expertise, our care team nurses who all have skills in major diagnostic categories. We have a team of oncology nurses, musculoskeletal nurses, pediatric nurses, and so on, and they always get 4.9 or 5 out of 5 stars because they're really holding the member's hand throughout the process and making sure that they get what they need. And for CenturyLink, the Net Promoter Score was a little lower than our book of business, which is running at plus 92 currently, but still world-class. And 95% of the surveyed respondents said that having access to 2nd.MD increased their appreciation of CenturyLink's benefits. So that was kind of a really powerful message for CenturyLink to hear after that first year. And our turnaround time, I think, the turnaround time with which you can get access to an elite level expert is really important in driving engagement. People don't want to use a service that takes weeks and they can't speak with the expert. And so that's some of the innovation that we bring to the expert medical opinion market. I'm going to close there so that we have time to get your questions. And also, please, if you have a best practice to share regarding engagement, we'd love to hear from you as well. So we're going to stop there and open it up for Q&A.
Great. Thank you, Kristen. We do have some questions already submitted, so let's start with this one, which is directed to Barbara. You mentioned that cost savings was important but secondary. When you were at Disney, how were decisions made about what programs to add, what to keep, etc.? What have you learned about 2nd.MD and their approach to engagement that's unique? Barbara, are you on mute?
I am on mute. No, great question, and I'm going to show my bias immediately by saying what we were really interested in at Disney was improving the quality of care. We put in programs that we knew would improve the quality of care, including identifying groups of physicians, for example, that had lower C-section rates, better infection rates, things that we knew would really make a difference in the outcomes that our employees experienced when they actually had to interact with the delivery system. We also had a huge focus on primary care, and we can talk about that forever some other time. But really it was about improving care. And, cost savings was not paramount. Now, I say that, and there are probably people at Disney who are really not happy to hear me say this, and it might not be the case for you. Employers that have very thin margins, where cost is paramount, there may be other ways that they look at these kinds of programs. But for a company that, like Disney, doing well and where the productivity of creative employees was absolutely number one, the most important thing was to improve the quality of care. And I just will make a little pitch here, and that is that we all know that the delivery of care in various neighborhoods, communities, and markets can vary greatly. And let's be honest, there are delivery systems out there, physicians in hospitals that do not provide the very best care. And this is where having a second opinion service like 2nd.MD comes in and says, look, we will send you to the very best. I mean, one of the things that we heard about was their hospital network. I mean, they've got Mayo, Stanford, Boston Children's, MGH. I mean, these are the best hospitals in the country. So if there's ever a question that your employee is not getting the best care, you want to take a step back and say, look, there's something else that we can do to improve this. And I apologize. I mean, the second part of that question was what about deciding the types of programs?
What have you learned about 2nd.MD and their approach to engagement that's unique?
Oh, good. Thank you. I really do want to answer this. And look, I am an objective observer. I do not work for 2nd.MD. I was stunned at the level of customer satisfaction. You never see net promoter scores as high as you see with 2nd.MD. And why was this? Number one, speed to service. And I'm going to put in quotes, unbelievable speed from the initial call. This was a quote that we had from one of these companies. The moment they get on the phone to get to a specialist is extremely fast. And I think for employees that are really concerned about an upcoming medical service or fear that they have a terrible problem, having someone that can hold their hand, wrap their arms around, and do it immediately makes a huge difference. I think the other thing we learned about flexibility and innovation, this idea, and I think Kristen represents this idea is, you know, we're working with you and we're going to do what makes sense for you, and we're able to be flexible. So definitely heard quite a bit about that. This idea of face-to-face video was important, and of course everything is changing in the virtual world today. And I think a lot of people are going away from face-to-face, but that does seem to make a big difference. But really this access to high standard care really made the difference. I could go on, but I won't. So someone else can ask the question.
Thanks, Barbara. Kristen, how successful was the outbound calls for CenturyLink? What percentage of users who received calls engaged?
Yeah, that's a great question. So I don't have the CenturyLink specific data in front of me, but what I can tell you about our overarching program. So we are identifying about 1,000 members a day for the customers that are leveraging our proactive outreach program who are interested in talking to a nurse and moving forward with an expert medical opinion. What we find on any given file is that about a third of the file doesn't have the best data for us to do outreach, and we do some creative things to try to find the best contact information for people. But then for the remaining 2/3, we see about 20 to 30% of people who are kind of interested in taking advantage of the program. And then there's a little bit of a haircut once a member speaks to a nurse in terms of completed consults. But we see the program to be very, very effective. Comparatively, it's certainly more effective than the outbound calling programs at the health plans. So we continuously monitor and we continuously improve the way we conduct that outreach, but we're really, it's a high-performing team, and we're seeing great success with it.
Great. What are the reasons given by employers for not using a program like 2nd.MD, given the strong data? This is puzzling.
You know, we say that inertia is one of our biggest competitors, right? We understand that health plans and employers have limited resources, right? Our service is one of the easiest lifts for the greatest return. We actually make implementation really, really easy. So it puzzles us when we don't see, when we hear, we love what you do, it's just not, prioritized for next year. So, talk to us in 6 to 12 months and we'll look at it again. Hopefully you gain from this webinar that this is a service that can have an incredible impact. And I will tell you that as easy it is for consumers to use, we make it that easy to implement. We take a lot of the heavy lifting off of our health plan and employers' backs so that this is something that you can kind of squeeze in with your other priorities.
I'll mention one other thing.
Go ahead, Barbara.
This just might sound it's a little bit off to the side, but I think for some employers, your feeling is, look, I pay a lot for my medical plan today. I pay a lot to the carrier to provide me with high quality physicians. If I put in a second opinion program, does this mean I have less trust in my own medical network? And I think that, for most employers now, they realize that, quality of care varies tremendously across this country, and that getting a second opinion should be something that the medical community encourages. And I think you're seeing more of that, especially around specialty care, where physicians truly cannot keep up with the level of innovation and change in medical care. So I think rather than suggesting that you don't trust, the current network that your carrier is providing to you, I think it's to be looked at as a partnership where 2nd.MD can take over when it's a very complicated case and you need more information.
And one thing that I'll add, with some of the health plans that we do partner with, provider abrasion was one of their biggest early concerns. And from our perspective, we're very collaborative with the treating physician, and we do peer-to-peer consults as well. But it's not so much about being wrong, but it's having another set of eyes to weigh in and make sure that you're getting it right the first time. And that's something that most physicians really embrace, and they appreciate the opportunity to speak with the expert who led the clinical trial or who led the innovation in shoulder resurfacing or whatever it is. We're really going after those elite niche specialists who have more knowledge than the local physician does.
Absolutely.
Great. Thank you both. Unfortunately, that's going to have to be our last word on the subject because we are at the top of the hour. If we didn't get to your question, 2nd.MD will follow up with you offline. Thanks very much for joining us today for the webcast. We hope you found it valuable. And I'd especially like to thank Barbara and Kristen for taking the time and sharing their insights and experience with us. Also, a special thank you to 2nd.MD for sponsoring this event. If you missed any part of the presentation, you'll be able to listen to a recorded version within 48 hours on the EBN website, and we'll be sending you an email with a link to that recording. Thanks again for being with us, and have a great rest of your day.